the housekeeping issues for us all to follow. Please could you switch off or make silent your mobile phones. Keep your microphones switched off at all times unless invited to speak by myself as the Chair. And when invited to speak, please switch on the microphone nearest to you and introduce yourself. Thank you. So moving on to the agenda, item 1 is public questions. We haven't received any public questions for today's meeting. Item 2, can I have a mover and seconder to the minutes of the meeting on the 15th of March, please?
Move it, Chair.
Councillor Shield, I think you were going to raise something.
Thank you, Chair. Yes, just the accuracy of the item providing a sustainable solution for Wellfield School. There has been an omission made by a Cabinet member, and we need to move an amendment to make sure that that information is included in the minutes, Chair.
Yeah, I believe Councillor Wilkes did speak on that report, so can we just add into the minutes for approval that Councillor Wilkes did speak on the report for Wellfield?
On that basis, I move those minutes, Chair.
Thanks. Can we have a seconder, please?
Yes, subject to the amendments that's mentioned by Councillor Shield. I'll second it, please.
Thank you. Can we agree the minutes then with that amendment as a true record? Okay, I can therefore confirm that the minutes are agreed. Item 3, declarations of interest. Are there any declarations from members this morning? No. If we move on to item 4, which is the Health Protection Assurance Annual Report. It's a joint report of the Corporate Director of Adult and Health Services and the Director of Public Health. Can I ask Amanda Healy, Director of Public Health, to present the report, please?
Thank you, Chair. Amanda Healy, Director of Public Health. Colleagues, the purpose of this report is to update on the health protection assurance arrangements that we have in place in County Durham, but also to give an update on the activities that have taken place in relation to health protection over the course of the last year. We now have a health protection assurance and development partnership, one of the kind of transition arrangements from COVID, and that meets on a bi-monthly basis and oversees our kind of key strands of health protection that are outlined in the executive summary, and which I'll run through as part of this report update. The key issues, obviously, as well, are identified and acted upon from last year's report, which include the significant work that's been undertaken to restore some of our screening programmes, in addition to ensure that we've continued with our vaccination programmes, learning from COVID, and our Leave No One Behind approach in County Durham, and some of the assurance of emergency preparedness arrangements that we learned certainly from COVID. And also the beginning of a sexual health strategy, which is well underway and will be published later this year. In the last year, we've seen some achievements in our health protection arrangements as well, including very close collaborative working with other parts of the system, particularly when there's been change in the system, and a lot of work at a national level with some emerging threats in relation to things like polio detection in wastewater, which we haven't seen for many years. Obviously, diphtheria cases potentially in asylum seekers and refugees arriving in the UK, and we saw a massive increase in Group A strep cases. So we have seen some really important work locally in terms of our antiviral prescribing pathways and the development of a surge response plan and escalation plan, which again is learning from COVID. So there's some achievements in the report as well. I will come back to the areas for improvement and further assurance and then the recommendations. So the report, it does outline obviously the background to health protection arrangements from kind of paragraph 7 to 18, outlining our statutory requirements as a council. This is one of our mandated public health functions to protect the health of our local population, delegated from the Secretary of State to the Director of Public Health, and has a range of responsibilities within there. So the background sets out the different, some of the partnership arrangements that we have in place, and quite often the delivery of health protection comes from others, although I'm delighted that we retained a Protecting Health team in the council beyond COVID, which has stood us in good stead to work with other parts of the council on areas of work such as the climate change agenda, for example. But you can see in that background there are a wide range of organisations that are involved and deliver their role. We also saw emergence of new organisations. So we saw the Integrated Care Board come into being on the 1st of July, and they took on Category 1 response arrangements for emergency preparedness, but also will in time take on other health protection arrangements, and they oversee our local health resilience partnership as well. So again, assuring health services of some of the work in relation to preparing for emergencies. And I think one thing which has been probably quite helpful to us locally in the last year is I've taken on the advisory lead for the Association of Directors of Public Health, which means that we get input at a national level and shaping some of that national policy. And beyond COVID, and you'll see in the report, different issues have emerged over the last year. Paragraphs kind of 19 to 23 outline our local arrangements and the arrangements that we do have in place within County Durham for those strands, screening, immunisation, outbreaks, our strategic regulation interventions delivered through Alan Patterson's corporate area, and preparedness to response and incidents and emergencies. We do also this year, you'll see in Appendix 2, have an updated scorecard, which is hopefully much easier for people to understand, and that is updated on as regular basis as we get the data, and helps us to have early insight of any issues. And then paragraphs 24 right through to 45 outline the assurance arrangements that we do have in place, and I do feel fairly assured of the arrangements that we have in place locally, even though it is quite a complex landscape with a range of organisations such as UK Health Security Agency, NHS England, the Integrated Care Board, all having their part to play in relation to health protection. And I think what we have seen is that some of our local arrangements play into those regional and national arrangements, and we do obviously have other groups within the council, such as our health, safety and wellbeing strategic group, our local area air quality management arrangements. So they're all drawn together and report and feed into our health protection assurance arrangements, and this work also goes through and into the health and wellbeing board. And then I was just going to pick out a couple of key areas in those strands. So from kind of paragraph 46 through to 116, you'll see the updates from those key strands. I think we've seen the majority of our screening programmes be restored and high coverage for County Durham, which is obviously really important. Particularly we've seen that for cervical screening and for breast screening and bowel cancer screening, but we still have some of the other programmes that are not fully restored post-COVID as yet, particularly our aortic aneurysm screening. So that is something that will come into our action plan for the forthcoming year. In terms of our immunisations, it's always a delight to say that our 0 to 5 uptake is very, very high for County Durham, and we do look under the surface at any variation, which is really, really important. However, what we have seen is some of our school-based immunisations drop below the standard that we would expect, and there's some very detailed work as well as seeking assurance for that from our provider and their commissioner for those services. So particularly for HPV, which is obviously really, really important. So it's an area of real focus for us. We did see post-COVID or flu vaccination rates remain high in County Durham, and we did some really innovative work changing the contract for flu for our 2 and 3-year-olds to deliver them more flexibly into some of our nurseries, which so helped to see an increased uptake. So we're always looking at new ways to try and address inequalities through our work, and we had a small piece of funding to help us do that through the ICB. We have, in terms of communicable diseases, they have re-emerged, I think is fair to say, in the last year, where we saw the Mpox outbreak really hot on the heels of COVID, which was very challenging, particularly for our sexual health services. But we have also seen the re-emergence of some of the foodborne infections, and as I've mentioned earlier, we saw a huge increase in Strep A just before Christmas. We did do a really effective training programme post-COVID for our workforce, working really closely with colleagues in the Civil Contingencies Unit and our Community Protection team, which helped to increase the competency of our staff. And we are keeping a very close eye on some of our sexually transmitted infections and late diagnosis of HIV. I think in terms of the strategic regulation area, that's been an area of significant review in the last year, and has really ensured that their focus for their staff in terms of retain, recruit and train has come really to the fore. But again, real focus on areas such as food safety, health and well-being, pollution prevention, private sector housing standards and other infection interventions. So really close working with the team within the council. And then finally, our Civil Contingencies Unit has been kept busy with a range of desktop exercises and testing of national, obviously we had Mighty Oak recently, but a range of exercises you can see from 102 onwards. And some really in-depth work over winter looking at the use of multiple data sets to target people not just affected in terms of possibly cold weather and from an emergency preparedness point of view, but obviously from the cost of living crisis too. So I think what we see in terms of this report is that this function is a significant function of the local authority. We had a lot of learning from COVID. It's that I think we have very robust processes in place for the assurance of our health protection arrangements. I think in terms of there are areas for improvement and seeking further assurance, which I will obviously undertake as an officer for this report, and that is really to continue working in terms of our school age immunisation coverage with NHS England. We'll obviously look at working very closely with our primary care colleagues at uptake of certain vaccinations, and we'll really input at a national level to shape the system so it is and we can have that assurance. So Chair and colleagues, the recommendation is to note this report, to note that it does provide broad assurance for the process of health protection assurance in County Durham, but also that there are areas of improvement and further assurance, and that these arrangements, the arrangements we have in place are now obviously post-COVID, incorporating COVID, but are re-established as health protection. Thank you, Chair.
Thanks, Amanda. Can I ask Councillor Chris Hood, Cabinet Portfolio Holder for Adult and Health Services, to speak to the report, please?
Thank you, Chair. Health protection is a statutory function of the local authority. The Health Protection Assurance Annual Report provides an update to Cabinet on health protection assurance arrangements that are in place to protect the health of our residents and the areas where work has been identified to provide further assurance in the coming year. The report notes the key achievements during 2022, including the sustained and ongoing recovery of screening and immunisation services where delivery was impacted by the pandemic, the significant work of our Commission Sexual Health Service to respond to the Mpox outbreak, the coordination of agencies acting together to manage the avian influenza outbreaks, and the exercises undertaken to test out our emergency plans. The report also demonstrates the strength of the partnership relationships to achieve this. These include the UK Health Security Agency and NHS England, as well as DCC colleagues, including environmental health officers and the Civil Contingencies Unit and local healthcare, GPs, ICB Place and the Foundation Trust. The identified recommended actions for the coming year include further improvement in performance of the screening and immunisation programmes, particularly of young people in County Durham, and the efforts to increase equity of access to screening and vaccinations to address unwarranted variation in uptake in different communities in County Durham. I'd like to thank Amanda and the team for the comprehensive document, and I ask Cabinet to note the report.
Thanks, Chris. Is there anyone else wishing to speak to the report? Okay, as it's for noting that we don't require a seconder, so can I ask Cabinet to note the report, please? Thank you. Item 5 is the Q3 2022 to 23 Performance Management Report. Can I ask Steve Evans, Head of Corporate Affairs, to present the report, please?
Thank you, Chair. Steve Evans, Head of Corporate Affairs. This is the Q3 performance report, which takes us up to the end of the reporting period, 31st of December 2022. The report is structured around the ambitions set out in the Council plan and has a balance in there of indicators which relate back to the County Durham vision, which are areas of great importance and significance for us, and also service level performance indicators. The main report is set out at Appendix 2, but there's a useful summary in the covering report in paragraphs 14 to 65, which set out specifically the strengths and performance challenges and what we're doing about areas of performance challenge, which you will find of interest. The report itself goes on to respective scrutiny committees and receives review and feedback from those committees themselves. So there's an assurance process built into the way that we're reporting and delivering on our performance. So Cabinet are asked to note the contents of the report, please, and if there are any questions, happy to answer them. Thank you.
Thanks, Steve. Can I thank Steve and his team for this detailed and comprehensive update on our performance against the targets and actions set out in the Council plan. Once again, the report highlights that our performance in some areas continues to be impacted by the legacy of the pandemic and from the current cost of living squeeze. In terms of those areas where we are performing well, I was pleased to note and pick out a few areas in relation to the stated priorities. So for our economy, over 250 more core tourism businesses are trading in 2022 compared to 2021, as more businesses reopened following COVID closures. Durham Book Festival, Seaham Food Festival and Brass Festival were evaluated during Q3, and they showed a combined economic impact of almost £850,000 and significant returns on our investment. Under the environment, we expect the Social Housing Decarbonisation Fund to help almost 1,200 social housing properties increase their EPC ratings and reduce energy costs by September 2023. Our people referral levels to children's social care are in line with the last 2 years and below benchmarks. Our continued low referral rate positively impacts upon this, with fewer children requiring children's social care support for a second or subsequent time. In the 9 months ending at the 31st of December 2022, 1,134 families were turned around via the Stronger Families programme. 1,039 attained significant and sustained outcomes and 95 maintained continuous employment. We have exceeded the annual 2022-23 target. The Adult Social Care Reablement Service supports people to maintain their independence for longer periods. In the latest quarter, almost 93% of older people were still at home 91 days after discharge from hospital into reablement and rehabilitation services, the highest proportion since 2015-16. And the rate of adults aged 65 plus per 100,000 population admitted on a permanent basis to residential or nursing care continues to reduce. The latest rate of 450 is a reduction on the same period last year, where it was 489 and is below target of 474. Within our communities, although there have been fewer net housing completions due to the volatility within the housing market, we remain on track to achieve 1,308 net completions per annum. We are continuing to help residents and communities through the cost of living crisis with various initiatives and funds. For example, during Q3, we provided £200,000 of grant funding to establish a network of 168 warm spaces. Our Household Support Fund also enabled us to distribute food vouchers worth £110 to more than 28,500 households. Despite the challenging financial environment, our 2023-24 budget continues to support low-income households through our council tax reduction scheme. And within our council, we are committed to supporting young people into the workplace and also investing in our workforce so that they can provide excellent services. Currently, 2.7% of our workforce is enrolled on our apprentice programme. That equates to 484 employees. 270 are new to the organisation, 214 are existing staff upskilling, and more than 100 new apprentices have been recruited since August. The report highlights a number of areas requiring our attention, where for a range of issues our performance has not been what we would have liked it to be in terms of areas requiring attention, where I know action is and will continue to be taken. And I would note, in 2021-22, 45% of Key Stage 4 pupils achieved a 9 to 5 pass in English and Maths, which is slightly lower than our statistical neighbours at 48% and England at 47%, and the North East at 46%. Education Durham continue to work with all schools, academies and trusts, ensuring that County Durham's young people have equal or better access to high quality teaching and provision. We continue to see an increasing trend of children in care. The latest figures, and may have changed since this, was 1,042, although high for County Durham, the rate of 102 per 10,000 of 0 to 17 population does remain lower than in our regional and statistical neighbours. Significantly more requests for EHCP assessments across special educational needs and disability services are being received, and this reflects a national picture. The proportion of adult social care users receiving an annual review continues to remain low at 61%. To address this, a new central review team has been created to provide additional resource. And of the 922 Care Act assessments completed within Q3, 61% were completed within the 28-day timeframe. Ongoing work is in supporting social workers to ensure that completed assessments are updated on the care management system in a timely manner. There are a range of other areas to note that are set out in paragraphs 14 to 65 in the covering report, which adds additional context. I would recommend that people would read that. With that, I propose that the Cabinet note the recommendations set out at paragraph 12. Has anyone got any questions that they would like, or anyone else wishing to speak on this report, please? Okay, can I ask Cabinet to note the report? Thank you. Item 6 is a consultation of the Rights of Way Improvement Plan 4. Can I ask Alan Patrickson, Corporate Director of Neighbourhoods and Climate Change, to present the report, please?
Thank you, Chair. This report seeks Cabinet approval to start a 12-week public consultation on a revised Public Rights of Way Improvement Plan. This is version 4 and referred to in the report for short as RAWIP 4. So all local highway authorities have a statutory duty to produce a Rights of Way Improvement Plan, and the plan will set out how the authority will manage footpaths, bridleways and byways for the benefit of residents. The COVID-19 pandemic has illustrated that our residents more than ever before perhaps understand the value of the local public rights of way routes for the benefit of not only transport and activity but also for mental and physical health. Therefore, RAWIP 4 comes at a time when people use, need and value their local public rights of way and other recreational routes, perhaps more than ever. The plan sets out a strategic vision which outlines how the local authority will address the extent to which rights of way meet the present and likely future needs of the public, ensuring that the network is fit for the 21st century. The previous plan, version 3, ran between 2015 and 2018, so is now out of date, and this is a timely revision. So RAWIP 4 is by design more strategic than the first 3 plans and consists of 4 strategic objectives and 8 policies, which are designed to remain relevant for the next 10 years rather than a 3-year lifespan. As part of drafting the plan, we've carried out extensive co-production across not only different council departments but also external organisations to develop and draft the plan. And this co-production process has been fundamental to drafting the 4 strategic objectives and 8 policies that will frame the investment for the next 10 years. So those 4 strategic objectives are, firstly, to manage and enhance the network so that it's fit for the 21st century. Secondly, to promote the network so that it contributes to the green economy by marketing the county's high-quality environment. Thirdly, by empowering communities and individuals to move more. And lastly, to ensure that the county's network are accessible to people of all abilities. These objectives have also incorporated ideas from those external organisations that we've consulted with, and these are as diverse as the National Trust, the County Durham Sport, and the County Durham charity, the Walk and Talk Trust. The headings of the 8 policies to be consulted on are contained in the report with a summary of the intention of each policy contained in paragraphs 28 to 39 of the report. These policies will be open to public scrutiny through this consultation. In summary, the plan is a long-term strategy with an improvement plan for the county's public rights-of-way network. We're creating policies as a mechanism for delivering objectives for the benefits of our residents and visitors over a 10-year time frame. A shorter 3-year delivery plan will be produced following the consultation, but this consultation draft is to make sure that we have the correct strategic objectives and policies in place before finalising the detailed maintenance and investment programme. Cabinet is asked to agree the recommendations which are outlined in paragraph 13. Thank you.
Thanks, Alan. Can I invite Councillor John Shuttleworth, Cabinet Portfolio Holder for Rural Communities and Highways, to move the report, please?
Yeah, thanks, Chair. The public rights-of-way network is an important, although sometimes overlooked part of the highway asset. The county needs an up-to-date, forward-thinking vision for how we can enhance, promote and protect some of these outstanding assets. Members will note that the existing plan is now almost 5 years out of date, so this important report is somewhat overdue, and it's good to see that this is being addressed and put right here today. The plan this plan looks to be more strategic than previous versions with a 10-year lifespan, and will put the authority in a strong position to draw in external funding and help to set priorities for resources already allocated for the public rights-of-way improvements. This plan introduces several important new themes, particularly around ownership, accessibility and communication, which reflect the changing nature of the network and public attitudes to it, particularly following the efforts of the pandemic. The network allows for everyday exercise, accessible to all, which can be have positive impacts on improving mental and physical well-being for all, in line with the DCC emerging physical activity strategy, moving together, which I need to do really. As a council will see, we always emphasise the importance of consultation, and we will therefore be seeking views on these documents for the next 12 weeks from May the 3rd until the 26th of July to inform their final content. And I'd just like to move the recommendations as printed. Thanks.
Thanks, John. Can I invite Councillor Elizabeth Scott, Cabinet Portfolio Holder for Economy and Partnerships, to second the report?
Yeah, thank you, Chair, and I'd like to thank officers responsible for bringing forward this excellent report. Councillor Shuttleworth has outlined the value of the rights-of-way network and its valuable role not only as part of the highways network but also as part of the county's tourism offer and for recreation and active leisure for our residents. The objectives and policies in the plan reflect important themes set out in the Council Vision, the Council Plan, and also in support of our Climate Emergency Response Plan, the Inclusive Economic Strategy, and our Developing Ecological Emergency Response Plan. All of these important initiatives have been thoroughly refreshed and reframed in recent months. The proposed plan specifically seeks to improve signage, bridleways, the Stockton and Darlington Heritage Walk and our cycle routes, local footpaths and more engagement with our communities when managing and protecting our routes. It will also seek to protect landowners by diverting footpaths out of farmyards and ensuring that everyone follows the Countryside Code. Chair, this plan sets out a long-term strategy with an improvement plan for the Rights of Way network, which puts the right policies in place to help residents and visitors alike to explore the county's outstanding natural countryside. I therefore support the recommendations to seek the views of the public on this draft plan and receive another report back here to Cabinet on the results of that consultation. Thank you.
Thanks, Elizabeth. Is there any other Cabinet members wishing to speak on the report? Yeah, Councillor Bell.
Thanks, Chair. Richard Bell, Deputy Leader. Our footpaths and bridleways are hugely important, as has been said, for leisure tourism, recreation, health and increasingly for travel to work and to school. Our core budgets are necessarily limited, and following the consultation, I would like to see the Public Rights of Way Service bring forward local proposals that AAPs and councillors through their delegated neighbourhood funds can support if they so wish. Thank you.
Thanks, Richard. Anyone else? No. Can we agree the report and its recommendations, please? Okay. Can confirm that the recommendations are agreed. Moving on to item 7 is the Corporate Asset Management Plan 2023 to 2025. Can I ask Amy Harhoff, Corporate Director of Regeneration, Economy and Growth, to present the report, please?
Good morning and thank you, Chair. Amy Harhoff, Corporate Director of Regeneration, Economy and Growth. The purpose of this report is to seek Cabinet approval to the Corporate Asset Management Plan to cover the period 2023 to 2025. Our land and property assets are fundamental to the successful service delivery and building on strong communities and supporting economic growth across our county. The assets we have are varied both in type and locality, from managing parks, schools and children's homes to delivering office and industrial space. With assets valued at over £1 billion, 23,000 acres of land and 893 buildings, the Council is one of the most significant landowners in the county. An asset base of this size requires strategic direction and an encompassing framework that recognises how land and property are essential to delivering the Council's and the county's wider objectives. The Corporate Asset Management Plan has been prepared to capture and to support the delivery of this aim. It sets out the basis for how our property and land assets should be managed and how we wish to improve the estate. And it also shows how we're making a positive contribution to both the delivery of public services and the growth and development of the county as a vibrant and ambitious place. As a 2-year plan, it recognises the work underway to implement the corporate landlord model, which is key to the successful management of an asset base of this size and scale. This reflects the work of officers across the Council who have put into practice strong governance and processes to ensure this corporate priority is delivered successfully. The plan is split into 3 key areas, and they are the asset management strategy, which highlights the strategic context and factors that will influence change and translating organisational objectives into property objectives. The second aspect is the asset management policy, which sets out a framework of rules, cultures and behaviours that will ensure the consistent management and high performance of our property assets. And finally, the third aspect is the Asset Management Action Plan, which is a plan of activities and projects that will deliver our property objectives. The plan being presented is designed to provide a statement of strategic intent for the near future. Underlying it is an extensive programme of activities that will embed this corporate culture across the organisation, ensuring that the needs of the whole council and county, as well as individual service operations, are met. Over the course of this plan period, a second stage, a longer-term corporate asset management plan will be developed that incorporates the progress made within the action plan and reflects changes in working practices and corporate ambition. This work will culminate in a longer-term programme being brought forward to Cabinet at the end of this current 2-year period. Property is influential in the success of the Council's ambitions. It provides suitable places and spaces from which to deliver our public services. Examples include schools, children's homes, housing, and the County Durham Lettings Agency. Property is also vital to the creation of jobs, new housing, promoting economic growth and supporting our ambitions of climate change. Chair, the recommendations are set out in section 7 of report, and this concludes my presentation.
Thanks, Amy. Can I invite Councillor James Rowlandson, Cabinet Portfolio Holder for Resources, Investments and Assets, to move the report, please?
Thank you, Chair. The size, shape and location of our land and property portfolio is vitally important to the success of the Council's ambitions. It provides space for the delivery of our public services. It helps to create jobs, housing and economic growth, as well as income to invest in our services. We have an ever-changing range of economic, social and financial challenges to navigate, and the strategic management of our property is paramount to make sure that we use this valuable resource wisely and with agility. These need to be rooted in good governance, assurance and clear decision making to ensure the best value and transparency for the use of the public assets, and the processes put in place by the Council to assure the Cabinet that it is achieved. The Corporate Asset Management Plan sets out the context and the ambition for the next 2 years of how the Council intends to be more effective in how we use our estate, how we can do these things more efficiently, and how we ensure that our assets decision making benefits the whole of the authority. Chair, I would like to put on record my thanks for the Corporate Asset Management team who have taken this work forward at pace over the last 2 years, despite wider challenges in the economy through COVID and the cost of living crisis. I would particularly like to thank Susan Robinson, Head of the Corporate Property and Land, and Anna Wills, Strategic Asset Manager. Chair, along with the council tax, our assets are the backbone of the council, providing much needed revenue to support our services. This plan sets out how we improve that income. Labour have ignored this funding stream since the start of the Unitary Authority, failing to bring in hundreds of thousands of pounds a year into the council through our substantial assets. This plan will rectify those failings of the previous administration. Chair, I propose the recommendations set out in paragraph 7 of the report. Thank you.
Thanks, James. Can I invite Councillor Richard Bell, Deputy Leader and Cabinet Portfolio Holder for Finance, to second the report, please?
Thank you, Chair. I would add my thanks to the teams who have produced this plan, and I welcome the ongoing process to ensure the best use of our assets. The Corporate Asset Management Plan is a strategy that sets out at a high level how the property portfolio will support the achievement of our corporate priorities and objectives, and it provides strategic direction for the ongoing management of the extensive land and assets interests of the Council. An effective Corporate Asset Management Plan is essential to support the objectives set out by my colleagues Councillor Rowlandson and the Director responsible, Amy Harhoff. And it is also essential for the effective management of scarce resources, managing our operational estate effectively, ensuring best value for our disposals and timely management of our buildings. These are all key to the Council's medium-term financial plan, as is maximising our income from assets, and equally as important is supporting our communities through agile management of assets. Therefore, I am pleased that this plan will support that ongoing review. I therefore second the recommendations in the report to approve the Corporate Asset Management Plan and develop the second stage of the plan to report back to Cabinet in 2025. Thank you, Chair.
Thanks, Richard. Is there anyone else wishing to speak to the report? Yeah, Councillor Wilkes.
Morning, Chair. I'd like to thank Councillor Rowlandson and officers for bringing this plan forwards and indeed addressing other asset issues too. When we took over the Council less than 2 years ago, we identified that the previous administration had cut back investment in our assets team to such an extent that it was struggling to function. Our investment is now helping to turn that round with additional officers. However, clearly in the current employment market, this is not easy, and fixing decades of failure will take time. Chair, what has become very clear to me is that Labour were asleep for the last decade and more. To have not had an updated asset plan for so many years was not acceptable. In so many areas, we've been left with problems which will take years to address. Unbelievably, issues are still there from local government review back in 2009. For rental charges to have not been reviewed, in some cases for over a decade or more, pretty much shows that Labour was taking the mickey with taxpayers' assets. I'm not even sure they knew what assets we had. I'm therefore delighted that this joint administration is now addressing the issues we have been left with by the previous Labour administration to make sure that we are using our assets properly, reviewing rents and addressing key issues. I'm minded to recall the sale of a certain council school in the east of the county for £1 by Labour, only for it to be repurchased for 50,000% more. It's these kind of things which should be a reminder to residents of why we can't let Labour back in to run this county. Having in place a robust asset plan is essential to ensure that this kind of thing doesn't happen again. Chair, I support the plan. I also support us moving forwards quickly to address some of the issues which have blighted our communities too, with, for example, run-down council-owned properties, which I know are important concerns in some of our communities and for some local councillors in those areas as well. Thank you, Chair.
Thank you. Is anyone else wishing to speak to the report? Okay, can we agree the report and its recommendations? Okay, I can confirm the recommendations are agreed. Item 8, any other business. I haven't been notified of any other business, so I'd like to thank everyone for taking part and to those members of the public and media who have watched the meeting online. That concludes the business for this meeting.